Okay, guys, today I wanted to address a chronic issue that is therapy for cancer. All along, what has been the biggest bottleneck in treatment of cancer is nothing but the fact that whatever, whether it's chemo, radiation, or whatever, kills cancer cells also kills normal body cells. With the result, the cancer patients destroy not only a large number of cancer cells, but a sizable number of normal cells of their own body, resulting in apparent visible phenomena like hair loss and a lot of internal tissue damage. Now, in the West, the medical world has been experimenting with T lymphocyte therapy for cancer. The T cells or T type of lymphocytes actually can destroy cancer cells. But the huge issue is the human lymphocytic antigen or HLA. Human lymphocytic antigen prevents the use of T lymphocytes from someone else who is incompatible. Or in other words, treatment with T lymphocytes was limited to particular person, particular type of cancer, and particular organ, making it extremely costly and extremely risky. See, what is called as MHC, the multi-histocompatibility complex, means the compatibility of lymphocytes is limited to specific person, specific type of cancer, and specific organ which is affected by cancer. Now, this made cancer therapy with T cells, T lymphocytes, extremely costly and extremely risky. But recent research by Cardiff and other medical schools revealed a type of T lymphocytes which is called MC7G5 T cells. MC7G5 T cells. These lymphocytes or these T cells have a near miraculous property. It can actually used universally. It tracks down the MR1 or the MHC, one related protein or MR1, which is associated with cancer cells. So the specific type of T cells, MC7G5, attaches to the MR1 or the MC-RAT1 related protein, which is characteristic of cancer cells, and destroys them specifically. In other words, it doesn't cause any destruction of the normal cells or normal tissues. Moreover, the biggest surprise and biggest advantage is nothing but it can be used universally. To put it simply in layman's terms, it's like a blood group which can be used for all individuals, something like O negative. The MC7 G5 type of T cells can be used universally, or in other words, it is not specific for a person, it is not specific for a type of cancer, and is not specific for an organ affected by cancer. It can be used universally. So please note, now we have a kind of biological warfare against cancer. We have identified and isolated a type of T cells which tracks down or hunts down cancer cells specifically, destroys them. And what is wonderful, or what is surprising, what is even more, is that it can be used universally, or the MC7G5 T cells from anyone can be used on anyone else. Moreover, it doesn't do any damage whatsoever to the normal cells. It hunts down, tracks down cancer cells and kills them specifically, and it can be used universally. There is no need of any personalization of therapy, which was making the T cell therapy enormously, exorbitantly, and unaffordably costly. It was a kind of treatment only for millionaires. Now here, right in front of us, we have a safe biological kind of warfare against cancer cells using the MC7G5 T cells from any individual. Please note, from any individual, which can be used on any other individual. And it will track down and destroy cancer cells specifically without causing any other collateral damage to normal cells or normal tissues. So good days are coming for cancer patients, and big things are in the making. Let's wait with our fingers crossed. Thank you very much.